So, I got the news a lot of micro integrated questions were there this time, and I'm happy to say again that obviously most of them they were there in the notes, and this is the recall session, and we could not able to get all the options correct. Obviously, I could not able to get all the options and all, and I need your help in that only. That particular images or any sort of options which you know for that building, and we'll discuss up some of the options and some of the questions, and I like to tell you the right answer and all, and please do help up in the comment section that which all are the options which you think were there in the exam. Okay, and a proper recall session we'll do later on. Now this was there or not, you tell up the first one, please tell. And if you remember up that we have done this in one of the online sessions itself. 5-year-old patients with meningitis, low sugar, high WBC, pleomorphic, gram-negative bacilli, they are found. What culture characteristics will confirm the diagnosis? So obviously we have talking out in this particular one regarding the Hemophilus influenzae, and how we don't know that, because low sugar, high WBC, this suggests what? This suggests the pyogenic meningitis, and this particular line, pleomorphic gram-negative bacilli, takes it towards what? Hemophilus influenzae. Okay, takes it towards what? Hemophilus influenzae, and you know that this organism shows up satellitism in presence of Staph aureus. And what is satellitism? Satellitism is increase in the size of colonies around the Staph aureus streak, because what they get from that X and V stuff. Okay. And that's why the Hemophilus influenzae, which is there, which loves to grow on what? Chocolate agar. And I suppose this was there, and the answer is A. Yes. Yes, please. In the comment section. Are you seeing up? Okay, ABCD have told yes, sir. Okay. So this was there, and I suppose everybody must have done this. The satellitism in presence of Staph aureus. Right, Ashwin. Very good. Okay. All others, please also answer up in the comment section. That will help us to make up the options also and all that. Can you tell something about the other options if you can? Otherwise, the answer is clear here. The satellitism in presence of Staph aureus. Now, the second one, the HRP2, this particular card test, which is a immunochromatographic test. Okay, which is what sort of a test? Immunochromatographic test. This particular one, this is a malaria antigen card test, and this is based on what? This is based HRP2. I have already told you the answer is Plasmodium falciparum. Yes or no? The answer is Plasmodium falciparum. Yes, please. ABCD, was it there? HRP2 based card test is used for which Plasmodium? So answer is Plasmodium falciparum. And obviously for all others, that is Knowlesi and all that, you use up the LDH and aldolase based card test. LDH and aldolase based card test, they are being used for others. And here we have this HRP2 one, which stands for what, guys? Histidine rich protein. Okay, which stands for what? Histidine rich protein. Is it fine? So this, I suppose, is also clear of you must have done that. Okay. Now there was a question regarding the LD bodies. Somewhere is telling they have given the LD bodies, and in the LD bodies they have talked about the kinetoplast. Okay. So one question was regarding the kinetoplast was there in the structure, and another one was somebody was saying that a resident of Rajasthan was there and having the oval bodies and an ulcer. Okay, and they have given up regarding this, that kinetoplast is present. So answer to that question, obviously they are talking about Leishmania, but this Leishmania is which one? This is Leishmania tropica. Okay, this particular Leishmania is which one? This is Leishmania tropica, and it is the cutaneous leishmaniasis, is also termed as Delhi boil, Baghdad boil, and that particular one. Okay, so Delhi boil, Baghdad boil, Aleppo button. So this was told, and I suppose Leishmania tropica was asked in the exam. Fine. There was question regarding multiple partners, a female with lower abdominal plane, the most likely organism which is there, mild vaginal discharge and scanty intermenstrual bleeding, that particular one. And one of the options was regarding trichomonas. You can complete up this particular one, exactly what was there. So is the motility and all was given off, like twitching motility and all, and what else was there? So all that you can tell off. Okay, so twitching motility was given, and what is given. Now there was a question, guys, this one, that oral candidiasis is there after the prolonged treatment of asthma, and the treatment was asked. Treatment to be given is. So guys, in this the answer is flucytosine. Okay, if at all that is in the options, flucytosine. Okay, why? Because it's a antifungal drug, and in the treatment of asthma, like obviously the fellow have become like immunosuppressed and develops this oral candidiasis. For that you will use this particular drug. Okay, Rahul, you told for the previous one, terbinafine was there too. Okay, so terbinafine, griseofulvin, cotrimoxazole and flucytosine. So most likely will be flucytosine. Terbinafine will not play a role here. Then this was their herpes encephalitis, and the next best investigation, and the MRI was done and all that was given off, and they have asked up that which particular investigation you will go for. So obviously you will go for the CSF PCR for the herpes simplex virus, which is like HSV1 you can go for. That is also termed as Malaria meningitis here. Fine. So this CSF PCR, you can go for the herpes simplex virus. Okay, this can diagnose up. The Zank smear was also there, but better than that, a rapid one will be this one. Okay, so answer will be B here for the herpes encephalitis one, and you can add upon whatever you know, that which all options were there and what exactly the question was. Now this was there, painless, non-tender ulcer, and there was painless inguinal lymphadenopathy. That was also there. And obviously we are talking about what, guys? We are talking about syphilis. Okay, we are talking about what? Syphilis, because in that the painless ulcer with painless inguinal lymphadenopathy was there. And you can tell that this was there or not. Fine. So this is there in this syphilis. Syphilis is the answer. Then this I was talking before, the patient with West Rajasthan shows some oval bodies and ulcer, and this is a typical history of cutaneous leishmaniasis, and this particular one is done by this species of leishmania, that is Leishmania tropica, and the disease is termed as oriental sore, okay, Delhi boil or Baghdad boil, also termed as Aleppo button. Okay, also termed as what? Aleppo button in this particular one. So this is also to be like and in this question I suppose that was given up regarding the kinetoplast and all that. Yes or no? That was given regarding the kinetoplast and all that. So answer to this question is Leishmania tropica. Now the Leptospira was asked, and in that they have given up the history of fever, jaundice, blood in urine, and this particular word which I have already mentioned of, that this might be asked of. So that is conjunctival suffusion, means inflammation without exudates. Okay, that there is the reddening of the eyes without the inflammatory exudates. That particular one is termed as this conjunctival suffusion, and this is typical of what, guys? This is typical of leptospirosis. Okay, that is typical of what? Leptospirosis. We heard na, triple R, rat, rice and rain. And the investigation of choice as per the serology is concerned, answer is MAT. You already know wheal phallic test is done. That's a heterophile agglutination test, and that's a cross reaction between proteins and rickettsial species. And the Paul Bunner test is also there, which is being done for Epstein-Barr virus stuff. Okay, so answer of our question is MAT. I suppose D option you can tell off that what is the D option of this particular one. Okay, what is the D option of this particular one? Might be that the game changer. Okay, otherwise microscopic agglutination test and macroscopic agglutination test both can be done in the case of leptospirosis. So Harshit have told Leishmania tropica was there. Okay, so that was the answer, guys. The Rajasthan one and having a kinetoplast. Surely the answer is Leishmania tropica. Okay, that is the oriental sore which is being done by that. Okay, and I have told you here, this mat might be microscopic also, it can be macroscopic also. The microscopic is better than the macroscopic, and we already know this mnemonic. A cat is sitting on a mat. They are the serological test, and cat is done for the mycoplasma. Okay, SAT is done for the brucellosis. Okay, and this mat is done for this leptospirosis. Okay, diagnosis of rotavirus was asked. In one of the questions, the diagnosis of rotavirus was asked, and obviously you will go for the stool antigen assay. Okay, okay. Was question जिसमें सीवर वर्कर का हिस्ट्री दिया था. Okay, Adarsh have told that there was a history of सीवर worker. Okay, but that was leptospirosis only. सीवर worker also this is happening. So answer will be regarding that itself. Okay, stool antigen testing that is being done. Okay, that is rotavirus antigen is being detected in the stool by various methods like ELISA. Immunochromatographic methods are also available. So basically you go for what? Stool antigen testing. Right or no? Can you tell me this, guys? In one option it was antibody, but antibody is generally not preferred, guys. It is the antigen which you need to see up, rotavirus antigen in the stool. So answer our question is the rotavirus antigen in the stool, that will be the best. Fine. Obviously you will not be culturing here because virus, they take time to culture and all that. So you need to know that. Okay, and it's very difficult and tedious also to culture. So answer here is what, guys? Answer here is rotavirus antigen testing in the stool. Is it fine? Now, this you already know that this was given of PDA, there was decreased hearing, premature with low birth weight, and all those features of congenital rubella syndrome, that is PDA, and cataract and sensory neural deafness. If they were given off in the question, we are talking about what? We are talking about rubella. Okay, we are talking about what? Rubella. Very right, Adarsh. Very right. Now, was this there? See this particular question, that petechial rashes, hepatosplenomegaly, jaundice, and there was like calcification seen, and in the same question it was given owl eye appearance also. So obviously if it is owl eye appearance, we are talking about what? Cytomegalovirus. That is owl eye appearance in this particular one. Is it with this language or something else? Can you tell me? Okay, Adarsh. Thank you. So this is like straightforward. Cytomegalovirus, which is also termed as HHV5. Okay. So here I am not here like delaying your party. I am just telling up that this have come and the answers of it, and the better version of this particular recall I will be recording later. And you can help me up in building up the options and all, so that will can be a good one. Achha, from urine it was observed. That I told na, that the best sample for congenital this CMV detection is urine itself. Adarsh told, sir, all questions were from your notes. Thank you so much. Thank you so much. So can you tell me, guys, what was the question regarding the Koplik spot one in the measles? What was given off? Adarsh, can you tell me? In the Koplik spot one questions, which was regarding the measles, what was given up in the history in the question? Anybody? That what was the history given up in the question? Yes, please. In the Koplik spot, somebody was telling like they have given up a history. Achha, fever with rash was there. Okay. The fever with rash. And what else? Direct fever rash, Koplik was given. Okay, okay. So this is done. Measles. Okay. Rubiola. Now, was this there? Cholangiocarcinoma is done by Chlorichae sinensis. Like people are telling that this was there directly. Achha, so Matostatin told in trichomonas, one option was given, not transported by sexual contact. So it is transmitted by sexual contact. Obviously it was like it's a STD. So Matostatin is a STD, it is transmitted. Fine. So cholangiocarcinoma question was there. C for C. उल्टा था पूछा कि कोलेंजो अच्छा okay. So cholangiocarcinoma, this is what? This is guys trematode, and this you already know that trematodes are termed as flukes, and in them the first intermediate host you know is always snail, and in this particular one the second intermediate host is. So there was a question regarding this also, na, burning micturition, and there was a discharge, and in that they asked up, they have given a picture also of gram-negative cocci and all. Have they given up? Have they given a picture of this particular gonococci, and they have asked up regarding the treatment part of it? Achha, Dr. Abhishek is telling yes. So answer to that question definitely will be ceftriaxone, okay? Because I suppose they are like to ask regarding the gonococci. Okay, Joshi told yes, it was there. So ceftriaxone was the answer of it. Yes, sir, diplococci ka pic tha. Okay, fine. And they must be pink colored, and they are within the intracellular, na? They are like within the cell, intracellular. Okay. So gonococci ka pic tha. So obviously we are talking about what? We are talking about the drug of choice. Drug of choice for that is ceftriaxone. Okay, so this is very clear. Filariasis वाला क्या question बोल रहे थे यार? Like you all were telling up regarding the filariasis one. What was the question regarding filariasis? This I have not got up till. What was the question regarding filariasis? Anybody? What was asked in filariasis? The diagnosis or the surgery part, or somebody else will discuss up? Somebody was telling like they have given a picture also of Kaposi sarcoma. अच्छा DEC provocative test एक option में था. Actually question क्या था आदर्श? What was the question regarding the filariasis one? What was the question? Can you tell what was the question? Like what they want to ask up in that? DEC provocative test we do in the daytime testing, so that everybody knows. But actually what was the question? If somebody can tell. अच्छा Ayush is telling about this question that this picture was there. अच्छा वो question recall नहीं हो रहा, कोई problem नहीं है. You take your time. And do put up in the comment section, Adarsh, that what was the exact question. Ajay, peripheral smear was given a microfilaria. Now, this Ayush was telling that there was a question that mouth open with many nodules and soft palate. So, that was only the picture, or like they have given up some history and then they given this picture. And guys, somebody was like, tell about this first. Everybody, like Adarsh, you can also tell. Prithvi, you can also tell that in this particular question of Kaposi sarcoma, in which they have given up a mouth picture in which nodules are there in the soft palate, HIV की history थी. Okay, there was a history of HIV. Very good. There was a history of HIV, and pic था और पूछा था Kaposi straightforward. Okay, done. अच्छा, somebody was telling that there was a question regarding the Gomori methamine silver staining, GMS. Okay. Gomori methamine silver staining, in this, I suppose again a picture have come. हाँ आदर्श ये हो गया, ये वाला बताओ. Pneumocystis carni, pneumonia. This particular question was asked in this pneumocystis carni. Black colony क्या हुआ? What was black colony? अच्छा, CD4 count is less than 150. So two questions are there. Like one was regarding pneumocystis carni pneumonia. अच्छा, black crescent shaped cyst. Okay, Prakriti have told. Black crescent shaped cyst. So Prakriti have told. Okay. So that you have na, the crushed ping pong ball appearance of pneumocystis carni cyst. They are black in color. This I have already told on GMS staining. If that is there, so that is done. Otherwise, the trophozoite stains green by this Gomori methamine silver. Yes or no? They stains green by this Gomori methamine silver. Fine. And Harshit, Prakriti, Adarsh, there was a question like somebody was telling regarding the this particular thing that a traveler have gone to Delhi or from Delhi and develops of the features of petechial lesions, and there was thrombocytopenia, the clotting time was normal and the bleeding time increased, and these platelet counts were around 20,000 and the WBC was around 3,000. So that's a typical case of dengue only. Others options they do not go with it, like somebody saying a scrub typhus was there in the option and all. Okay, Manisha, fine. So answer to that question will be towards the dengue only. Harshit, that's what I'm asking. DEC provocation wala test wala question exactly kya tha? Acha, the correct options was malaria, dengue options in that. So answer to that one is this only. That is the flavivirus dengue, and that fellow is going up into the dengue hemorrhagic and later on might go into dengue shock and all. Okay, so these particular ones, I suppose that question was regarding dengue only. What else as per you have come which you can tell me, sir, this was also there? Because this much only they could able to tell up till, and if you can tell something else is there in this particular one. This was also like microfilaria blood antigen positive. What is the next step in making a diagnosis? Microfilaria blood antigen test positive. Harshit, that was the question. So then you can do that test and you can demonstrate the microfilaria into the blood. You can do that DEC provocative test for that particular one. And Prakriti told that there was a question that HIV positive and there were lesions over the face. Yeah, that is disseminated molluscum contagiosum only, and we know that MCV2, this particular virus, this does more infection in the case of HIV positive ones. Molluscum contagiosum virus 2, which is a DNA virus, and this one does the infection mostly. Okay. And Harshit, I suppose if microfilaria blood antigen positive was there, peripheral smear was there given in the question, and these were the options given. So best is, I suppose, best in that, what he is telling in that filariasis question, best to do is demonstrate the microfilaria, and you will demonstrate it in the blood smear examination. You can do blood smear filaria demonstration for sure, Abhishek. Yes. And you can very well see and that question comes the tail tip free of nuclei. Then only you can observe on the blood smear. Then only you could able to identify that particular Wuchereria bancrofti is doing up this filariasis and all. So that you can easily find out in the blood smear. HIV patient, all nodules umbilicated. DEC, मतलब अब एग्जैक्टली क्या था वो ऑप्शन से पता लगेगा प्रकृति. डीसी प्रोवोकेशन भी हो सकता है, अगर डे टाइम टेस्टिंग करनी है तो डेट प्रोवोकेशन करने के बाद ब्लड स्मीयर ही तो करोगे ना. आफ्टर डूइंग द डीसी प्रोवोकेशन देन ओनली यू डू द लिस्ट ब्लड स्मीयर एग्जामिनेशन. यस और नो? HRP2 वाला क्वेश्चन हो गया. HRP2 वाला क्वेश्चन वी ऑलरेडी डिस्कस्ड अप. वन इज हिमोफिलस इन्फ्लुएंजाe सैटेलाइटिज्म वाला, दैट इज आल्सो बीइंग डिस्कस्ड अप. Any other one which you thought like was there? Ayush, what was the histoplasmosis question? Can you tell me? Like what was like TB-like features were given in that, or what was exactly there in that histoplasmosis-like question? If you could tell something regarding it. In this histoplasmosis, again the peripheral smear was given off. Leptospira is done. MAT. Prakriti, that in MAT, one option was veal phalanx, another one was like polmonal. Some other was also there, kya? Fourth option I could not able to get because that might be more confirmative than MAT. So it sounds easy that MAT is the answer. If PCR and all is being written up, then that would have been more good. Others, you were telling that HIV patient was given up, bilateral infiltrates were given off, and there was a smear in that question. Now this is what is the confusion, that the patient from Rajasthan was having in the peripheral smear those kinetoplast and all, and that kinetoplast, if that is there in that, we are talking about what, guys? Leishmania. These were the various ones. You can prepare up more options and you can tell in the comment section and all. And thank you so much. And you please help me up in this like building of the options and all. And from my side, enjoy your day and be with Ellen next, and other next one might be ENT and all. So you might be hearing of that. Peripheral smear of histoplasmosis was given off. So that must be like sort of a like Bihar se patient encephalopathy features. Baby with blue eyes, you know that, Harshit. So all this most of them you must have done all them the correct, and I hope everybody gets a wonderful rank. and get the like seat of their choice. Very best of luck. Keep in touch. Okay, and do join up this YouTube channel for more updates. See you guys.